pledge, please. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Father, as we gather together as the Finney County Commission, grant us the wisdom to deal with the issues in front of the county today. Furthermore, Lord, if you can give us some moisture, we'd sure appreciate it out here. But most importantly, Lord, bless our health officials. They've got quite a challenge with the COVID issues, and continue to be with them in their time of struggle and their work that benefits the county. In Jesus' name, we ask these things. Amen. Amen. Good morning, all. You might see from the screen that Dave Jones is absent. He's ill this morning. We wish him the best, speedy recovery. Other than that, I have no other comments, so I will open it up for the approval of the agenda.
So moved, Mr. Chairman.
Second. All in favor, say aye.
Aye.
Aye. Consent agenda.
Chairman, I move to approve the consent agenda without modification.
And I would second that.
Thank you. All in favor, signify by saying aye.
Aye.
Aye. Motion has carried. And we're whipping through this. Public comment. Anybody in the room have public comment that they would like to share with us before we get into our business? And I see the mayor coming.
Well,
Good
thank
morning.
you so much. Good morning, gentlemen and ladies. I just want to make sure and let you know, last regular meeting, we took up the item about fireworks. And so, but we tabled that really until we have a chance to discuss with you this year. I think that the state has done from the 27th to the 5th for distribution and discharge. And so we want to be led lockstep with the county. And so we really thought it was premature to make a decision until you had a chance to kind of think about that.
We have scheduled a work session for January, and that's right on the top of our list.
Okay, yeah. Then I think what we'll do is the same thing, because we want to make sure, we don't want to drive people out into the county. We know that we're an agricultural society, and our county really depends on those, and so we want to make sure that we really honor what we do as two governing bodies. So I just want to let you know that we have tabled that. Now I think we'll table that until your work session in January.
We need to do this right. We agree. So,
yeah, I agree. Okay.
But,
yeah, we know a lot of people order really early, and so we know that the more time we can give them, even though July seems a long time ago. Of course, Christmas seemed a long time ago back in July, but now it's just right around the corner. So I just also want to say thank you for all the work you're doing. The county website and all the work the health department is doing is really, really excellent work. So thank you, and I appreciate your day, and hope you have a really great meeting.
thank you. Appreciate it. Further comments from the audience? Yes, please come forward and state your name for the public.
My name is Don Dietz. I live at 2305 North Sherlock Road. I'd like for you to address an issue I have with truck traffic coming in and out of High Plains liquid feeds at the south end of Sherlock Road. It's right off of Railroad Avenue, and they have truck traffic coming in and out to the north to Jones Avenue. It's a dirt road. And when they put the plant in, John McClellan, he put it in, and he came through and visited with all of us when they put it in. We didn't contest it. He said all the traffic would come in and out of that plant to the south on Railroad Avenue. He paved that section from his entrance to Railroad Avenue. And we agreed to that, and from what I understand, I wasn't at the meeting, but at the meeting, it was consent that all that traffic would come in and out from the south on Railroad Avenue, no traffic on the north. They rebuilt that road after they put the plant in. I kind of figured things were going to go south, and they did. We get a lot of truck traffic on that road, dust issues, and the road just won't handle the traffic that it has. It's a rough I pull a horse trailer quite a bit, and when I slow down to pull into my drive, back into my pickup actually vibrates out from underneath the trailer. It gets so rough. And of course, when it rains and snows, it's just a pigsty, and then they quit using it. They tear it up and then they quit using it. They go back around to the south. But my biggest issue is, after they dump their loads at the feed mill, salt and urea, I finally got the feed mill to make sure that they close their gates on their bottoms of the trailer. And then they've been cooperating with that so far, but once the trucks leave that feed mill, they go north, go down that road a little bit, then they open their gates and dump their bottoms on the road. As little as a shovel full to as much as a wheelbarrow full. And of course, then the county grades the road, and it spreads that all throughout the road, and the dust is in the air. It gets in the horses' lungs, our lungs, it gets on our ground, it gets on our grass, pasture grass, our croplands. I've stopped several truckers and made them clean it up themselves. I've turned it over to law enforcement. They don't do anything. I've turned it over to DOT. Cargo securement. They don't do anything. Law enforcement's told me that you guys, as a group, need to control that road. And that's why I'm here. I'm asking that you restrict truck traffic in and out of that plant to the north and from the north. As was originally agreed upon. Some signs, and that's what the law enforcement said. Once you as a group act and determine what to be done, they can enforce something. But until then, they can't enforce anything. I don't know why they can't enforce that dumping, but they can't. And it's getting aggravating, and that's why I'm here. I don't want to put up with it anymore. Lived with it for how many years, I'm tired of it.
Have you spoken to the plant manager? Surely you have.
Oh, I've spoken with every plant manager. They change monthly almost.
Really?
Yeah. And John was good about it. He came through and talked to us all about that, and we addressed that issue with him, and he assured us that traffic would come in. And one of my neighbors attended the meeting, and it was determined that's why he only had to pay from his entrance to Railroad Avenue, because the traffic would go that way. Because it was at this meeting, it was addressed about paving that road.
Are there any other commercial operations along that road? Wallace used to have an electric field there, didn't they, or are they still?
That was on Jones, a road to the east. Terry Prince had his electric service out there for years, Freedom Electric, and now there's a tarp company, Western Ag, in his place. But they don't have semis, they just pick up and trailer.
I don't know, I guess we could talk about closing it to commercial traffic from off of Jones south. I don't know how that would affect those other businesses down there.
It would be through traffic.
Yeah.
And like Western Ag wouldn't be through traffic, because that's where.
Because we've done this on other roads, farmland out there on, we closed that one because we had the same problem.
Yeah.
I guess we could dang sure look at it and get our road and bridge people out there.
And I
don't know why they wouldn't take the blacktop. I don't understand.
I don't either. I mean, even the people that work there, they'll come down through there just flying in their vehicles and mud flying everywhere, and I'm thinking, a mile over is a paved road.
Yeah.
I don't understand it, but it like they say, they tear the road up and then they quit taking it. You know, the county engineer, we've had him count the vehicles a time or two, and, well, there's not enough vehicles going down it, but when you put those counters out there, those guys go around it. It's really aggravating. I'm tired of it.
Mr. Chairman, and for those online, this is Lon. I think we do need to take this under advisement, and as Larry just mentioned, I think we need to visit with our Public Works Director and have some research done on that and see what the options might be for us. But
that is the steps we need to take. We just start this is the first time it's been brought to my attention.
right.
So,
This was a picture I took Friday.
Yeah, you just,
They clean out the bottoms there.
It's done.
And that happens 2 to 3 times a week. And the one time I took a wheelbarrow load of this stuff off. That's ridiculous.
Robert, I guess we have you start the process of doing some homework for us and with Roger and bring us back
We'll start
some
working.
ideas and possible solutions.
Okay, very good. But the sheriff department told me they couldn't enforce anything until you guys restricted that traffic. They couldn't enforce anything.
It is a public road at this point, so.
And I don't understand why they can't enforce something like this.
yeah, I don't understand why, you know,
Yeah.
That's ridiculous.
And Mr. Chairman, we might, in instructions to Robert, check with the Sheriff's Department and see about that dumping issue and why that couldn't be enforced.
Yeah.
yeah, I don't think you need signage for that.
I wouldn't think so.
There ought to be an ordinance in place for that already.
Yeah.
The last guy that dumped that I caught, I followed him all the way to his home base, and he was dumping it all along the highway and everything. I mean, it just, and DOT won't do anything about it, and I don't know why that won't happen. Because you don't allow the oil companies to dump salt water on the roads anymore. I don't see the difference.
Okay. Ms. Neith, we appreciate your comments and we'll start the process.
What, is someone gonna contact me with this, or do I just guess, or what? No,
Well, it'll have to come back in front of the commission in 2 weeks, so it'll be a minimum of that.
But I would make sure Robert or Dory has your telephone number, so that somebody can't, do you have his telephone number?
Not the telephone number, but we'll get that, and I'll make sure that Robert has it, and when we're going to address it again during the meeting, we'll call and let you know, so you can be here.
Okay, thank you very much.
You are welcome. Also pass it along to our public works director.
Thank you, gentlemen.
Thank you.
Don.
Okay, let's move on. Alicia, it's your turn. Good morning.
Good morning. Long time no talk, eh?
Yeah.
Alright, the first case I have before you is FC 2020 PA-72, which is the H&S subdivision. It's located at the 5100 block of South Holcomb Lane at 6.77 acres. And the plan is they're gonna build a house on that here in the future. They haven't rezoned it, but they are in the process, so you should see that come before you here shortly. Any questions on that one? It's zoned ag as it is right now, but the current owners are selling it to someone else so that they can build a home out there.
So once they get ready to build it, they'll be back in.
They'll be back in, sometime, in February. They'll be at the next planning commission,
Okay.
in January, so you should see them about February.
Mr. Chairman, I so move.
And you're calling this a subdivision, Alicia?
Yes, H&S subdivision is what the plat is called.
Okay.
Approval of the plat, your H&S subdivision.
Clifford will second on the plat approval.
All those in favor of the motion signify by saying aye.
Aye.
Motion carried.
The next one I have is FC 2020 PA-74, which is the Isaac Farms number 1 edition. You'll see that there's 2 editions on this. The only reason why they don't come together is because they're not actually connected. They're not touching, the parcels are not touching. So it's located at the 7900 block of North 16 Mile Road. It's zoned ag and contains 10.25 acres. The property is not vacant. There is a manufactured home, grain bins, and a building on it. And it will remain ag until they decide to do something different. If they want to or not, it can stay as is, so long as they don't further develop it. The owner is selling that whole quarter section, but the people that are buying it don't want those little corners.
So this one can remain ag until further.
Yep, they can remain ag as long as nothing else is
Okay.
developed on it. It's once they want to change something that they'll have to rezone it.
Mr. Chairman, I would move that we approve the plat for Isaac Farms number 1 edition.
Clifford, second.
All in favor of the motion for FC 2020 PA-74, Isaac Farms number 1, signify by saying aye.
Aye.
Motion is carried.
The last one is FC 2020 PA-75, which is the Isaac Farms number 2 edition, which is located at the 7700 block of North 16 Mile Road. Like I said, same thing, it's just a little bit smaller, and it is, it's not vacant, it's got a couple buildings on it. Like I said, these are the only parts of the property that the new person did not want to purchase.
Mr. Chairman, Dr. Clifford, I move to approve the plat for FC 2020 PA-75 Isaac Farms number 2 edition.
Second.
Any further discussion? Questions? If not, all those in favor signify by saying aye.
Aye.
Motion is carried.
Thank you.
That didn't take you very long. Good to see you. Okay, now Spark Grant Program update, and that would be Jeff, and I saw his name on the screen. Good morning, Jeff.
Morning, Mr. Chairman. How are you?
I'm terrific. You?
I'm doing well. It's a cool, crisp morning here.
Yeah, I would agree with that. Definitely here too. All right.
So, Mr. Chairman, what we have for you and the commissioners to look at today are a number of grants. And we'll start first with the Household Emergency Relief Grant. We have 20 of these here for you in front of you for a total of $46,584.95. These have all been checked, and these are households in need throughout Finney County. There's one maximum award who had experienced some increased challenges here. Everybody else is averaging around $2,000 an award, just north of $2,000. Any questions on these?
Gentlemen?
Dr. Clifford, were we able to accommodate the 2 late applicants? I see
Yes.
Roxanne is here, and she's shaking her head. Thank you, Roxanne.
Is this the extent of the list, Jeff, or would you have a few more to clean up on the 20th?
We do have a few more to clean up, Mr. Chairman. There's a number of them, and one of the things that we discussed is, I'd also ask the County Commission to look at the Board of County Commissioners to authorize Robert to approve the grants up until next Friday. There were some items as we were going through the final QA/QC that documentation was missing, and we were ready to make the awards. I shared with Friday. There were a few individuals who, instead of putting their government ID, their driver's license, they took a selfie. So we obviously need that ID to be able to finalize the grant. So I think there was some confusion, and our staff is working with Roxanne's staff. Worked over the weekend, so thank you to Roxanne's staff for trying to get as many as we could in front of you today. And we're going to clean up the rest of them this week. We'd encourage you to authorize Robert to make those awards. And the reason behind that is we could bring them back to you at the next adjudicate and get all the paperwork and the checks cut, because for each one of these grants, it could be a multitude of checks that need to be cut. The landlord, the utility, the various utility providers that they have, so one grant involves a significant amount of administrative work. So by doing, by allowing Robert to be able to do that, it would allow us to get ahead of the game a little bit.
Will we need to grant Robert that authority over the agency operational as well as response and recovery, or is that strictly for the household emergency?
Just for the household emergency, the response and recovery and the agency operational, those are you have the final pieces here right in front of you, and we'll talk about those next.
Mr. Chairman, just a question, Jeff. If all of those are awarded that you're talking about that we give Robert authorization for, what would be the approximate amount? I'm not needing an exact dollar, but how many more dollars are we talking about?
1 second, Commissioner Piston, I thought I had that file up and I had the wrong one up. So, just bear with me a second. You will, on the overall, you're going to be well under, for your household, what you had originally intended for your household emergency relief grants. We initially budgeted $1 million, I think at maximum. With the outreach coordinator, the time, and with the outreach coordinators, the time that everybody put in, and all of the grants, we'll probably spend about $300,000. Just there wasn't, as many people in need within the county. So that those dollars can be moved and can be applied to the other grant programs, and we'll talk about that, at the end of my discussion.
Yeah, and I appreciate all that, Jeff, and I know we will talk about moving funds, but I guess I don't have any agenda or anything, but I'm just wondering how many applicants that are pending.
Number wise.
And then about what would be the maximum dollars if they're all approved that we would be authorizing Robert to approve.
So you have you'll have about 100, assuming that everybody gets their paperwork back, you'll have about 110 applicants. Of the ones that are remaining, if they go on the averages that you all have been spending on, we'll see about another $100,000.
Okay. That's what I was trying to get at. Yeah.
Okay. Yeah. No, and that's that's our projections. But when we're finding, sometimes we find some large ones that pop out. But you've been roughly hovering so far with all the grants that you've made. You've been hovering around 2,700 per applicant. This one is this set is a little bit lower, about 2,200 an applicant. So just kind of gives you an idea that we're call it 2,500 an applicant. We've got about 40 left, so that's
Okay.
where we're looking at.
Yeah, what you said right here at the end, that's what I was asking about. So thank you.
Gentlemen, would like to do this
Want a
in
motion?
2 different motions, please, to approve the ones presented today, and then we'll grant in a second motion.
I so move that we approve the ones that are presented today for the household.
And Mr. Chairman, I would second $46,584.95.
Any further discussion on the motion? All those in favor of approving the ones presented today, signify by saying aye.
Aye.
Aye. Motion carried. What Dr. Clifford and I were at the Sparks meeting when we discussed this, and just simply to grant Robert the authority to go ahead and approve these without us commissioners meeting, and because since time is of the essence to get all this done, that's where this idea came about.
And I would,
So discussion or questions?
well, Mr. Chairman, what I understand from what Jeff just said is up to 40 additional applications and to approve what might be appropriate for those applications.
Do we need to put a number like that on that, Jeff? Is that safe to do, or could, we said 40?
No, I'm not necessarily saying it needs to be in the
Oh, okay,
motion.
okay.
I'm just saying that's what I understand
Correct.
we would be authorizing. so.
Correct.
And with that, I would so move that we give Robert that authorization.
Clifford seconds.
Further discussion? Hearing none, all those in favor of the motion to grant our administrator the authority to approve and get these Spark household emergency relief grants out. All in favor say aye.
Aye.
Motion is carried. All right.
Great. So, Mr. Chairman, moving on to the agency operational relief grant. Before you today, we have this is the last cleanup of those agency operational relief grants. Today, we're recommending 13 awards to you for a total of $1,351,322.50. There are 2 maximum awards for working capital in here, and then there are 3 awards that we're highlighting for you that we are not recommending. There are 3 applications that we received, and we're not recommending any award there. The three that we're not recommending are St. Catherine's. They actually withdrew their application because in talking with them as a follow-up to look at different pieces, they have other federal funds that are going to be able to pay for those items that they wanted to get under this grant. So when they had further discussions with their corporate entity based off my questions on duplication of benefits, they said, oh no, wait, we're fine. I think it's largely going to be paid out of the provider relief funds for this. Okay. The second is Garden City Community College. They had put in for hiring of vacant positions. Unfortunately, that's just not eligible under Spark. We tried to find a way to get there, but just given the time frame and what they were looking to do, the time frames were ineligible. And then the last one was Whitski Whereabouts. They operated a shaved ice business, and the costs that they were incurring were the pre-setup. They actually never opened during COVID, and due to some of the challenges that they had, and unfortunately, in a further review of their application as of October, they were not a corporation in good standing within the state of Kansas. So we're recommending $0 in terms of the award there. Any questions on these grants as they were submitted?
Dr. Clifford, I have a lot of questions. Okay. City on a Hill, they previously come with commission looking for funds. If I'm not mistaken, they operate out of another county. Suddenly we have a workaround to get $250,000 from Finney County. Is this justified?
This is. They had all the documentation that they had provided us. They work out of both Finney and Seward, and we had reviewed their documentation. Like when you go to their website, it lists Garden City as their main address, and this is one that we had talked quite a bit about. There is justification to be able to do it. This is all working capital for them, and then the expenditures are some of the public health response.
Yeah, and Jeff, that I sit on the Spark sort of task force meetings on Thursdays with Commissioner Dries, and I don't remember seeing this before. That's why my confusion.
I'm sorry, I thought we had talked about it previously. It's not something that we're trying to
And they're drug and alcohol rehab, or
yeah, they're drug and alcohol rehab, and they provide services. They do provide services in multiple counties.
So the thing I don't understand, and it'll kind of pivot into another issue, we've quibbled for months on providing daycare in Finney County, which would establish future community capacity, improve jobs and opportunity for folks who are working through this pandemic. Yet suddenly an organization which by policy, this commission has consistently turned down, except for a minimal award, I think last year, is getting a maximum award. So I'm questioning our priorities here in the AOR section.
You know, and Commissioner, as you know, I have been, you know, and our team has been working to find a way to get these daycare items going, you know, operational. You know, the challenges that we have with making a daycare award underneath the SPARK criteria are the licensing. You know, this is, City on the Hill is an existing organization that has history, that has stuff that we can make a grant under the SPARK conditions. You know, you'll see in the response and recovery, which we'll talk about next, is Turning Point Church and Nazarene. You know, the pastor and I worked throughout the weekend to finalize that number that's there, to get them everything that they need to set up that remote learning center, and also set them up for future success for a daycare. We worked very diligently. Robert identified an additional grant that they can go after for the state. That got submitted as well on Sunday. So, you know, I understand and appreciate the concerns, and honestly share many of the frustrations that we weren't able to get a daycare grant. I think everyone that was presented by the community, you know, we couldn't make the grant, you know, as we discussed in the task force meeting, we couldn't make the grant, unfortunately, because of, you know, on the 1.5 million, because the state said no, you know, and so the grant elements were a little bit different. We tried the East Garden Village opportunity and to get those trailers sited, but we couldn't get them open and operational before the end of the year. You know, and that was a late ad that we had talked about, just trying to get something together. You know, and then we tried something with the critical daycare services for county employees with the health department, and unfortunately, that wasn't going to be a viable solution. You know, I think the grant that I'm going to talk to you about in the response and recovery elements is going to be a massive, you know, a massive jumpstart to the future for daycare within the county. So, you know, and I think the other avenue, just to kind of directly answer your concerns. So as a commission, you can adjust these award amounts as well with the documentation that we provided by City on the Hill supports this. If you wanted to drop that down, we certainly can. But this grant program, the Agency Operational Relief Grant Program, was set up so that we can provide those organizations that were in business that were impacted by this. And I know mental health was one of the priorities for the county originally. So that was why, you know, this award is in here.
Okay. Personally, I will not, I'd like to table the City on a Hill if my other commissioners would consider that, so that I might, or we might see the justification and use of these funds.
Are they applying for funds in other counties, Jeff? City on the Hill?
They did apply in Seward, and this was, you know, they were located in Garden, so we thought that this was going to be on here. Seward had made them a grant under Seward's Response and Recovery Grant Program for some increased transportation, but they haven't provided them anything under the Agency Operational Relief Grant for working capital.
And Jeff, I appreciate that this is a going concern. Am I mistaken that there is not a going concern organization that promotes daycare? Lana Duvall's in the room and she might be able to address that. But if you're going to hang working capital on this organization, City on a Hill, could not we hang working capital on an existing umbrella that promotes daycare in Finney County?
We could, Mr. Commissioner, that could definitely be something that we can incorporate. We can do a late agency operational relief grant, you know, and I can work with Lana to see if we can pull something together for the agency, for the Finney County Early Learning Network.
Any comments, Lana?
Not related to that.
I'd like to see us do that, again, these are Finney County funds, you know, this particular, again, I guess I am knocking city on a hill because we previously had them here and we've elected not to support them at these, extreme levels. I realize they do good work, but, I think we need to take care of our own needs. If there is money for, all the above, so be it.
And Commissioner, I do think that we do have funds to do all of the above, and we just need to, you know, I can work with Lana to get a late AOR submission if we need to, for the child care network, and we can look at working capital there, based, and it'll be based on the formulas that we've applied for everybody else, and the all the documentation, so we can get that done ASAP.
I appreciate that.
And going back to the earlier point, you know, we can, if you want to give Robert the authority to make that award based on, you know, the program criteria, we can get that done this week.
I do think we have another meeting at least, is that not correct, Mr. Chairman?
We have a meeting on the 21st.
I unfortunately will not be here. I'd just like Sarah to display something on screen share that I think the commission needs to have eventually, and in fairness to Robert and to you, Jeff, this is the September distribution comparing different counties, and you'll see, of course, Finney County having been, I think, a little more diligent, does not show the funds as well divided as in other counties. I do think the commissioners deserve this sort of aggregate look at where the money's going. I would hope that that blue area is much diminished, as again, in referencing the state intention with Spark funds, we're to build community capacity, not just fill in debt for elected or government organizations. I realize that the educational piece was probably very well funded. I'd just like to see almost this kind of a breakdown for our county, so that we commissioners and particularly citizens would know where the money's going. Have any of you seen this before? Robert, have you seen this?
No, no.
I'm sorry, I'm not seeing anything on the screen, Commissioner.
We're seeing pie charts which show the September 3rd, 2020 distribution of Spark funds by counties that are relative sized counties to ours. And it would be, I think, instructive to the commissioners to see this as maybe a more final distribution of or disposition of our Spark funds. In September, we really hadn't, put anything out. Is this possible, Robert? Can we have this kind of data?
Yes, I believe so. I haven't, once again, I haven't seen it before, so I can take a look and see what.
I'm not as interested. I think we should see where the money's going here at the end game. I think we sit here approving individual programs, and I'm at the Thursday meetings, and I still have no idea of where the money is really going. I have this impression that we're going to rescue our county budget with a very large number and not have improved community capacity if we are meeting this December 30th deadline. Now I realize that's been a terrible deadline for us to deal with, and you have the flexibility in the county and in the city to absorb more of these funds, but I think the real intention was to get them out the door for community benefit. Can this be shared with Jeff, or so that he might be able to provide it?
Yeah, I just pulled up the Facebook Live meeting, Commissioner, and saw the graphic where that comparison comparison came from. I just don't know who put that together and where that underlying data actually came from. I'm assuming these are the state, this is data coming from the state report, and we're going to be a little bit in arrears of that because the majority of the reporting, the first time we started approving these grants was at the November 2nd meeting. So we've been in arrears of that overall. I can tell you that the top grant providers, or the top folks that money has gone to from a detailed review has been the county, USD 457, USD 363, Garden City Community College, the Juvenile Detention Center, and the City of Garden City. After that, those are the top 6 in terms of grant awards. After that, there's a number of businesses and other organizations within the community that really will be able to, that helps with that building of capacity like we've talked about. And then we have, the HHR awards that are out there as well. In total, assuming that everything gets approved today, I know there's some discussion about City on a Hill. We will have allocated $9,451,680.56, and that does include some of the other administrative items, outreach coordinators, our support, and some other administrative items like printing, cleanup, and those types of items. And then that'll leave us with about $1.4 million left to allocate as necessary. And this is where we had talked about public safety salaries for both the county and the city.
Yes, and Jeff, don't misunderstand me. I'm not trying to create a public shaming exercise here. I'm asking for this kind of a breakdown probably at the December 21st meeting so that the commissioners can kind of see. You did mention your top 6. I wasn't following perfectly, but it sounded all like government entities. And then on the tail end, 1.2 million, we're talking about government entities getting this money. So I would emphasize that. I know you've worked hard on this. I'd like to see this money get out to community efforts, particularly daycare.
Yeah, and that's where you'll see in the response and recovery grant award, like we talked about on Thursday, is that there will be a significant, that $121,000, doesn't look like it's a lot of money in terms of the overall, but in talking with the pastor, that was everything that they could think of that they needed to set them up for future success, to run the distance learning element now, and then set them up for future success, to launch a daycare, in partnership, that themselves are in partnership with the Early Learning Network. So, and they are, the other thing too to be mindful of is some of the additional dollars that were able to be pulled into the county. So we didn't put everything in here because there are some elements that they applied for a state grant. There's some, we're increasing connectivity in here, and really looking at those government awards too. Yeah, they're going to government organizations, but we're increasing connectivity like we talked about. We're improving. A lot of the spend from the school districts is to get one-to-one on devices. A large chunk of Garden City Community Colleges is to upgrade their network switch to get them, set up for now and into the future. Really building that capacity. So I appreciate that we haven't been able to make a direct award on daycare but I think some of the licensing concerns due to the deadline is definitely been holding us back.
No, and I witnessed the effort that's gone into this. I mean, no doubt that I appreciate that, and I also think some of these other counties are going to have some funds to pay back because they didn't do the due diligence that we've done here in Finney County. So I appreciate that effort. Thank you, Jeff.
As chairman, I'd like to make a few comments to address some of Dr. Clifford's concerns. First off, on City of the Hill, you know, they do provide public benefit to a lot of our citizens. And they did meet the qualifications that were put forth by the grant requirements. You know, there's a lot of individual businesses that have received money, not a lot compared to how many is in the county. This program was well advertised, I feel, and so I commend those agencies and businesses that chose to put forth the effort to apply for these grants. And you mentioned several times about the local government entities, school districts and so forth. A lot of these projects, I believe, that were covered by grants were going to be covered anyway by taxpayer monies. And I think maybe we saved a little bit of property tax going to these districts and governments. So I think it's kind of still benefiting on our taxpayers, I believe, in one form or another. But I'll leave that, my opinions to myself at that point, and then carry discussion from the other two commissioners that are here on the agency operation relief issue.
I have several things. I didn't know if Larry, you want to go first?
Go ahead.
Well, I had several things written down here. Jeff, it appears that Bill's request for that pie chart, that you would be able to provide that for us December 21st for Finney County and Seward County, since you're working with those two counties. Is that a fair statement? That pie chart?
I'm preparing data for Seward County. I can talk with them and make sure that they'd be comfortable with me sharing it.
But the pie
So it's all
chart for those,
publicly available.
Public information.
it should be public information.
Yeah, it's what you said, it's all publicly available.
Yeah. So anyhow, those two counties, I would think with your assistance, we can have that information by December 21st. I have just a clarification question. You said something about the Nazarene Church having another possible grant, and I think you mentioned Robert had discovered something. Is that through the state, or is that through some?
It's actually through the state. It was something.
It's through the state.
Dory had got a reminder of. It was an application for the distance learning and child care, and that had been open, I believe, since September 30th. It ended December 6th on Sunday.
Okay. But that was through the state, yeah, okay.
And it did identify faith-based organizations
Okay.
as a caveat.
And then, Jeff, you mentioned the licensing and so forth when you were addressing Bill's questions on daycare, and are those rules that you're referencing, are those ones that were set by the state, or were they CARES rules that flowed through the state, or I'm just needing clarification on where those rules might have been initiated?
Yeah, so those are regulatory licensing deadlines. They were pre-COVID, and Lana's in the room, and she's more of an expert as it relates to licensing. But in my discussions with Colleen and everybody else, it takes a couple months to even get licensed as a daycare to be able to be up and operational.
I might point out, guys, this is discussion that's going to be held in response and recovery grant part of this.
Well, these were just all follow-up to comments that have been made.
True, but we're mixing the two grants together here. Let's focus on the agency operational relief at this point.
And I think my last question that I have, Mr. Chairman, is related to that. It's been mentioned by Bill in his comments about businesses and maybe not enough of them receiving some help, or I'm paraphrasing, I'm not trying to quote you exactly, Bill. But I had a visit with the former Downtown Vision person just last week, and she mentioned to me how she was so frustrated that she had counseled so many businesses downtown to apply, and for a variety of reasons they chose not to apply. And that's no statement against what you're doing, Jeff, no statement against what we're doing here, but some of it was just personal choice by some of the businesses that she was encouraging to apply, and they chose not to for a variety of reasons. So some of those, I think, businesses had an opportunity and chose not to take advantage of that opportunity.
Capital. Nice job.
Larry? questions, comments?
Jeff, I haven't sat in on many of these Sparks meetings, but I was curious, all these entities have expenditures, and then some of them you award more than what they request, and some of them don't even have expenditures available, yet we're giving them the maximum amount of money. What, you wanna explain that?
Yeah, so it's two different pots. Under the agency operational relief grant, like we talked about, is they can submit expenditures, either planned or reimbursable that they've taken already, and then they can request working capital. And working capital is based on their tax return information, those types of pieces, and really it's based on working capital, their non-owner salaries, their rent, their inventory, those types of things. So, and it's calculated based off their, the tax information that they provide to us or the updated information. So when they request working capital, it's in a broad sense, and it's based on the documentation that they provide us.
Okay, so the working capital is for 2019? For 2019?
It's to help sustain that business in operation, for anything that they do, and it's based off their 2019 tax information. So there's, a perfect example is Buffalo Plains Health Center. They weren't open in 2019. They opened, just prior to the pandemic. So that was based on their lease, your utility information, and the salary information that they were able to provide us.
Okay, and in the one just above it, the hotels.
Yes.
Shiva.
Hotels, yes. And that's one that Roxanne's team worked very, very closely with. We had to isolate it to the operation that was within the county, and they provided us all their documentation.
Okay.
And for all of these awards, commissioners, at the end of this, we're going to give the county a whole package that has by award all the documentation that was used, all of the decisions, and how they were made, so that this way it's an auditable record. So if you ever get audited, hey, here's the program guidelines, this is what was done here, this is why it was done, everything else.
Further questions, comments on the agency operation relief grants?
Mr. Chairman, I would just simply make a comment on the City on the Hill, and I very much respect what Bill is saying about that entity. However, again, I think there's been publicity, there's been information out there encouraging people to apply for these funds, and so I would be willing to include them in this agency operational relief.
As always, you worded it much better than I. Thank you. Where are we at, gentlemen? Do we approve them or do we?
Chairman, so I don't have to vote against the whole package, I would move to approve the AOR grants and separately vote on City on a Hill.
Is there a second to Dr. Clifford's motion?
Second.
The motion, as I understand it, is to approve the 12 of the grants and separately vote on the City on a Hill. Is that correct?
And
Correct.
Any further discussion?
Well, just for public information, that would be $1,001,322.50 in dollars.
Further discussion? All in favor of approving 12 of the recommended applications signify by saying aye.
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 Now, discussion on City on a Hill.
Mr. Chairman, I would move that we approve the recommended amount of $250,000 in the agency operational relief portion of the funds.
Is there a second? I'll second. Further discussion?
Again, my objection is that I would like to see the documentation to support this particular award, given their prior appearance here and our commission denying them all the token funding.
Any further discussion? All those in favor of the motion to grant City on a Hill the $250,000 maximum award signify by saying aye.
Aye.
Aye. Opposed?
Nay.
Okay,
2-2.
bring it back.
My parliamentary procedure fails me. Is it a fail?
It is, yes, it did fail.
Chairman, I would move to table City on a Hill to the subsequent meeting where appropriate documentation could be reviewed.
Second.
Moved and seconded to table City on a Hill for further review at our next meeting. All those in favor of that motion signify by saying aye.
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 Aye. Opposed? Motion carried.
And Mr. Chairman, just a question to Jeff. That still gives time, if it is approved, by the deadline, to disperse those funds by the deadline. Is that correct?
I'll lean to Robert on that. From my perspective, yes. From an administrative perspective, Robert, I'll lean to you.
If we have all the documentation, I think we can make that happen.
We'll get it all ready to go so that if you approve it on the
Can that
21st, we'll get it.
documentation be sent out to the commissioners ahead of time?
Yes, in essence, it would have to deal with the award letter and, in order for us to move forward on it. But if you're wanting supporting documentation, we can get, with Jeff and forward that to you.
Is that agreeable to commissioners?
Yeah, I mean, two of us will be there Thursday. Can we see that on Thursday, or is that asking too much?
Is that
We
available
can
for
get it,
Thursday?
we can get it to you today.
Okay, very good.
Yeah, I figured it'd be already in place.
Yep.
Yeah.
All right, let's move forward to our final grant, the Response and Recovery Grant, our discussion on the Turning Point Church of the Nazarene and the Learning Center.
Excuse me, Dwayne.
We've discussed quite a little bit. Jeff, you have some more comments you can add to that discussion?
Okay.
Mr.
So,
Chairman,
you know,
Mr. Chairman,
like I
before,
said,
Jeff, before you go there, I think Dory had a question of the chairman.
Well, there were 3 applications that were denied on there, so we're gonna need a motion for that because we've done motions for the denials before.
She is correct. We do need a motion to deny those applications.
Mr. Chairman, I move that, we deny the 3, that were recommended for non-funding.
Clifford seconds.
All those in favor of the motion for denial of the 3 applications as presented, signify by saying aye.
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 Motion carried. Thank you. She keeps us in line, people. All right. Now our discussion on Response and Recovery Grant. Anything further, Jeff, to add from what I believe you covered it fairly well. Do you want to add some more?
yeah, I'll just, just let you know, this really, I think, I'm excited in the partner that you have here. On a personal level, the pastor and I spent a number of hours with each other, developing these budgets over the last 3 days. And the number here, it includes taking care of all of their major component systems so that it sets them up for future success. It gets them the new, new fridge, new freezer, so they can food for the students. There's plenty of enrichment activities when they're outside of their remote learning environment. We've got backups in case kids forget things. We've got plenty of PPE that's built in here. We've got some other some outdoor seating areas, some engagement stuff. I think it's a nice grant that sets them up to run the distance learning element in the near term for the students that they have starting today, but also gets them past, and set up for the future to be able to provide that more robust support and be successful in the future.
This is a project that the Commissioner's been aware of for quite a period of time now, and I think it's a fantastic way to get it operational, get it moving, and I appreciate your efforts on finding funding sources that makes this thing happen, Jeff. Appreciate that.
And I think that's, Mr. Chairman, I'm sorry to interrupt you, but that was exactly the point too, is that it's not just Spark that's gonna fund this. There are funds that help support it into the new year, through KDHE and hopefully through, the other grant as well. Nothing's gonna be duplicated too. We took great pains to make sure that there's gonna be no duplication of benefits.
Mr. Chairman, I would move that we approve the award to the Turning Point Church of the Nazarene in the amount of $121,285.81 in the Response and Recovery Grant.
Clifford seconds.
Further discussion? If not, all in favor of approving the grant, please say aye.
Aye.
Opposed? Motion is carried. We kept you on the line for quite a little while, Jeff. Anything further that you need to bring before us before the Thursday meeting?
I have nothing else other than I'll have those reports prepared for you prior to the commission meeting on the 21st, so that this way you have a chance to review them. And then as it relates to City on a Hill, we'll get you all the documentation. We'll send it to Robert Dory and how we made the justification for the awards. That'll be to you by the end of the day.
Excellent. Doctor?
Mr. Chairman, Clifford, I'd just like to compliment Jeff and Robert for all the work. I had a chance to talk to Dr. Stewart of Buffalo Medical Clinic, and she is thrilled to be supported, and I appreciate your efforts with her. I spoke with the Boy Scouts, Mike Stewart, no relation to Pamela Stewart. Again, very supportive of their operation, and appreciate what you did for the Scouts and many organizations. I still am a Pollyanna enough to think Congress will extend our deadline because they have to fund the government by the 11th, this week. So I think hopefully we'll decompress the deadlines, but I know what kind of work's gone into this to get this done on these timelines. So thank you all very much.
And I would echo that, thanks.
I think all of us will. Well done. All right. Have a good day, Jeff. We'll visit with you. Two of us will anyway on Thursday.
All right, thank you. Have a great day.
Any updates from Roxanne on?
Any comment, Roxanne, from your perspective?
So, in speaking to
Roxanne, would
the
you
different
please?
areas, sorry,
The public wants to hear you too.
just you guys. In speaking to the different areas, I will tell you that we did advertise plat, we advocated radio, television. We utilized the chamber, we utilized Downtown Vision. So every avenue that we had open to us, as far as marketing this and getting it out to the public. And I too spoke to several of the businesses who, for some reason or another, did not apply. So, Dr. Clifford, I echo your concerns that more didn't apply, but we can only do what we can do. I think we had, I applaud you for opening it up to the public, to the households. I know a lot of communities are calling me and asking me why they didn't do it. So I know there's a lot of people out there who are very, very grateful for the opportunity to open that up to the households. So there's definitely a lot of need out there. It's just getting the information. But I think we've done an excellent job. And I want to commend you guys, Robert and iParametrics. They've been very, very diligent. So I think you're not going to have any audit issues moving forward. So I'm excited about it.
Thank you. Doctor?
Now, did all of your hoteliers apply, or would it just?
All of my hoteliers were made aware of it. I had one group that applied. That was it.
Because if there's an industry that's hurting.
That's definitely an industry that was hurting, and I encouraged them. And so some of them didn't meet the 15% requirement by the timeline that was, because we had a very strong first quarter. So that percentage of decrease hurt them, because like I said, we went into the first quarter setting a record number. So then the bottom dropped out of it. So had you extended it to December 31st, those parameters for that 15%, definitely would have made it and then some, but the parameters of time frame kept some of them from applying.
Thank you.
Mm-hmm.
Thank you.
Thank you.
Okay, let's move on through our agenda. Information technology report. Doug, I think there you are. Good morning.
Morning. How are you guys today?
Great.
Sarah's got a couple of quick videos that highlight some of the north section. And the boring up here has been completed for a couple of weeks, and they're actually gonna start pushing fiber through this week. But this is just kind of a flyover of this section so we can see where they're about. This is Prospect. It's a little bit north of the health department in that section up there. We tried to stay off of, like I said, we tried to stay off some of the main roads due to the easements and how full they were. So we went a little bit north. We went up through Prospect and connected to Bellevue, which is just a little bit south of the Florence Wilson and the cemetery up there. And then we took Long Boulevard, which we'll see the intersection where we do connect to Long Boulevard. This is again just one of the roadways that we followed to get up there. This one I'm not, yeah, you can see one of the handholds out there at the end. And then the next one is just a couple of seconds, and it shows the intersection where we connect to Long Boulevard.
I think this is Bellevue. That was Bellevue.
Yeah, and this is just the intersection that shows Bellevue to the right, and it'll pan around. You can see the fiber truck right there. You can see one of our, or a couple of our places where they actually had to break through the sidewalk, and then they turn, and on the screen there at the bottom is where we connect to Long Boulevard, and we follow Long Boulevard all the way out to where we have to turn back onto Mary. And like I said, those are completed as far as the conduit, and they are pulling fiber into those this week, and we will be installing network equipment towards the end of this week up there. Other bit of news that's actually relatively important, we do have a response from the railroad company, and we are tentatively scheduled to do the bore underneath the railroad tracks on the 14th. That will connect. They've already been working down south on getting those buildings connected, so once we get the bore done, they'll be very close to pulling fiber on the south part. Further questions on the fiber?
On schedule, gonna make it?
Yes.
Have you lit any portion of your system yet?
Not yet. That's what's scheduled for this week. The north section will have fiber in it. We'll be lighting it up towards the end of this week.
So that connects what, EMS and health?
Yes. And actually it'll connect senior center and transit also.
Okay, well, good.
Yes.
Doug, would you just describe handholds to the rest of the commission? I go to the Idea Tech meetings, and I've been on the street with you, so I kind of understand that, but you referenced the handhold.
Yeah, the handholds is where they actually have to break through the surface to get the conduit underground. And when they do that, they put a box underground that has the fiber interconnects inside of it. So anywhere where we need to connect to a building, they won't be able to just go to the closest fiber point. They'll have to go to the closest handhold, which is an underground vault about the size of a coffin roughly. So it's usually about 6 foot underground, coincidentally.
That's kind of,
And
Nice way to put it.
yeah.
that's where we do all of our splicing to connect into the fiber backbone itself.
Okay, that makes sense.
I was wondering why you were connecting to the cemetery.
Right. No relation.
Yeah.
Further questions? Lawrence?
Mr. Chairman, so, and I'm not trying to put you on the spot or with an exact number or anything, but Doug, the last time that Idea Tech communicated with me and they had come out and inspected because they were having trouble believing the 63% completion that had been submitted by the contractor, would you say we're 80% completed, or what number do you think we're at as far as completion?
As far as the conduit itself, we've got well over 30,000 foot of conduit in the ground. We were every bit of 60% when they made that comment. We're probably 80% as far as their portion of completion.
Oh, okay.
Now, Finney County IT still has to put equipment in, but even with that said, we're a solid 75% complete of the total project.
Okay, yeah, I'm just trying to get a handle on it, yeah, thank you.
Sound
Other
good,
questions?
guys?
Well, thanks, Doug. Appreciate it.
Thank you.
Thank you.
Colleen, your turn. Health Department update.
You'll control it as soon as I get it on the screen for you.
Good morning.
Good morning.
This morning, what we figured we could do is do a demonstration of the new dashboard to kind of walk you through the features so that you can access the information. And then I can also update you on some of the numbers that will be updated on the site today. Sarah is going to be coordinating the startup of the dashboard, so as soon as that is up, I can start kind of showing you the features of that new dashboard here. Alright. So when you're on the finneycounty.org page, you can navigate. I'm trying to get this trackpad. There we go. So you can click on that banner to show you the dashboard. Here we have launched. Oh man. Sorry, this trackpad, I gotta get used to it here. So we have this table here, so it shows you the total number tested, total positive, negative, active, pending, deaths, hospitalizations, and the positivity rate. The positivity rate will be updated by end of day today. We usually do our news release. That rate is going to increase back to 48%. So we kind of had a jigsaw the last couple of weeks. We went from 47, decreased to 43, and now back to 48%. The current hospitalizations have not been updated yet today. We are waiting for that information from the hospital. All of last week, they were at full capacity. No more staffed beds. Big issues there, of course, for our community when our hospital is for sure full. So any precautions possible from our public would be as necessary now as ever.
Colleen, before you leave that screen.
Sure.
The positivity rate, is that current or for the whole COVID?
I'm sorry, can you say that again?
The 43%. You're fine, passed that too fast.
I can't
Back
handle
up.
this trackpad. The
That
positivity rate
43%, is
sorry.
that currently today's positivity rate?
So it will be updated today at 48%. So it's off of our last full weeks of
Okay,
data.
that's what I meant, not
Yep,
not
so-
for the total testing and all that good stuff. It's for the last 10 days or whatever, last week.
So it's the last full week of data. It was from the 15th through the 21st. Since that's our total data, we still receive results from those weeks, several weeks out, but that's our tracking as of now, with clearing up any pending results from that week.
Okay, thank you.
And then positivity rate, so most everything is updated every single day. Positivity rate is the only one on this that gets updated weekly. Because of that week's time, we want to pen out those entire full results. So okay. So here on this dashboard, you see this bar, there's these two white circles. It'll help you if you want to dial in and look at the information a little bit closer. You can pull the one bar towards the other, and and it'll help you move in on more local current data to show the layering. I'm trying to, Sarah, do you still have control over there? Can you scroll it slightly? Cause like this trackpad is really touchy and it won't let me like scroll down slightly.
Let me see what I can do for you, just 1 second.
Okay.
While we're waiting on that, Colleen, the age graph there to the right,
Yes, sir.
is that always been kind of that same, spread or layout as you're seeing that age group as the highest one normally?
Yes. So you can actually look at, sorry, you want me to stop touching it?
No, I'm sorry,
No.
there's no way I can.
Do it? Okay. I'm just like really struggling here with this trackpad. So up here at the top of the page, you can actually show, okay. You can view historical here.
Mhm.
So if you click on that, it gives you a variety of options. So you could do previous month and everything. Really consistently, these numbers have been a constant. The 20 to 34 group has been our number one. You can also, there's this tab underneath here, and you can look at total tested versus total positives. And they're actually very similar. You see that very slight change there? It would be interesting to also look at this of how this is representative of the population in Finney County. So do we have more 20 to 34-year-olds as well? Is that our highest population, therefore it's our highest number tested, and therefore our highest number of positives?
Pretty close.
We know that we have a very young population here. So I believe that stays very congruent.
So that's probably inverse of what's being admitted to the hospitals.
Mm-hmm.
It's the opposite of what's being admitted to the hospitals, yes.
And deaths.
So let me see if I can. I'm sorry, I'm really trying here. So here, down on the bottom, you can also navigate to the hospitalizations by day. And you can see over time, so this was back in May through till now. The drastic increase in hospitalizations, if you want to look at that a little bit closer.
Mr. Chairman, while we're on the hospitalizations, do we know, and I think you had the number on here, 23. Of that 23, how many of those are Finney County residents versus out-of-county residents?
I do not have that information. I can always ask the hospital for that, but that's more information for them to track. To kind of also keep it in perspective of what those hospitalizations are looking at, we still have several that are here, local citizens that are positives, that are hospitalized in Denver, in Kansas City, in Wichita, and several other locations. So really just tracking what's here local of current hospitalizations helps us understand the capacity of our local hospital. And those will kind of balance out, because we do look at, yes, we're kind of a regional center, but we do have other Finney County citizens that are hospitalized other places.
Well, what I'm trying to track, and I get the capacity question.
Sure.
I absolutely get that, and I get the fact that some are in other places, because
Sure.
I have a couple friends who are in other places. However, are not the testing, like if you had 13,000 tested, I think it was, or something, aren't those Finney County residents?
Those are all, yes.
Right, so I'm trying to get an apples to apples of the 13,000 tested, and of those positive.
How many of that
we could
percentage
keep
is
it at
hospitalized?
Finney County to Finney County to Finney County.
Sure.
Even though I recognize we're a regional hub, where we're getting people from other places, and some of our residents have been sent somewhere else.
Sure.
Because it's of interest to me if, and I'm just throwing a number out, I have no clue what it is, but out of those 23, if 15 of them are Finney County residents, to me that's more in sync with the positives. And anybody online, don't quote me on that because I have absolutely no idea how
Sure.
many of the 23 are Finney County.
Sure.
So I'm not asking for medical records or anything of that nature, just trying to keep things, in apples to apples versus apples to oranges.
Sure. So on this graph, by the way, you'll see if you want to hover over, it'll show you the number as well. So if you hover over the data point, it'll show you that number. Further down, we have the gender breakdown, total positives versus the total tested. So you have the two different tabs. So it shows that breakdown as well. We have positive cases by day. This graph. Oh my goodness. Let's see if I can get this page. If you look back in May, we had that very increased surge, and then over time you can just look at the width of that increase, and that gradual increase was very quick. And right now, if you look at when we started, we have a lot more disease prevalence and spread within our community, and so that's a pretty good visualization of how quickly things have increased here. We'll see if that really is hopefully a slip and a downward trend. However, having this much of an increase now before the holiday season, we're hoping it'll go down, but we'll see. We'll see how that goes. Hold on here. And it's not scrolling. There we go. In this graph, it shows our residents tested per week in the blue. The red are the cases per week, and then the cumulative case count, as you can see, our increased curve starting here, and how rapidly that has increased. So we were at 2,500 cases on week number 41. And now, the last piece of data was week 49, so in 8 weeks, we have almost doubled our total case count. Over here on the right, oh my gosh, this trackpad. Okay, so the red over here on the right graph are the positive cases per week, the positivity rate as we have been tracking it. And then this here is the cumulative. So that is the total number positive divided by the total number tested. That's our cumulative positivity rate versus our weekly positivity rate. So it shows you current active investigations, current positives over the population that is currently being tested versus our total number tested and our positivity of the whole community.
I think that's what I was trying to get at. Well, my question earlier, Colleen, so appreciate that.
Sure. So you see that increase here. We had the 47 down to 43. And then today when we update the graph, it'll be back up to 48% positivity. Here on the bottom, when you are on the mobile dashboard, you can actually scroll down and click this so it has COVID-19 mobile dashboard. If you click on that from your phone, it'll immediately turn to the graphs being full so that you can actually read them on your mobile device. So we did launch that mobile dashboard, so there is the two different dashboards that you can utilize. One other thing too that I forgot to show you guys up here is on the corners of these graphs, if you want to actually also enlarge the graph, there is this
Right.
little button here, if I can get to it, there you go. And it'll make that graph larger so that you can view that as well. Oh my gosh. So it'll enlarge that there. Additionally, some other resources that we have on this page. We have symptoms, testing locations, so all 3 locations in Finney County. We also launched an online appointment request form, so it's in English and Spanish. So we have that ability. Here's Genesis as well, the testing hours of all 3 testing sites, and then links to do any appointments, locations, times. There's a map here that also shows those different locations. There's, you know, a lot of educational tools in here. We have direct links here to social media sites for information as well. This one on the left is our health department social media page where we launch all of our news releases as well. Here, one of the other ones that has been kind of asked about is here on the newsroom press releases and notices. This is where we also have all of our copies of our news releases and death announcements. So if you ever want any copies of that or look at those press releases, there's also a copy in here. That's kind of the primary thing that I wanted to show you. Do you guys have any questions on total positive count for the 15th through the 21st is 228. So that's down from 385 the previous week. Sorry, 336 the previous week.
Has your testing numbers at the health department gone down since they've opened up the other facility?
Yes, we have had a decrease in testing over at the health department since Go Get Tested has launched. Holiday week, of course, was the first week that they launched. So really waiting to kind of see how that all pans out in testing capacity and demand for testing, how that'll change.
Probably give you a little relief.
Relief on those, at least on the testing side. So still a lot of positives still coming in to get processed. So we're getting there.
Now what's their turnaround time on their tests?
You know, so far I've heard a range of 48 hours to 72. Some on that first week had results in about 36 hours. So it was a little bit quicker then. They're launching several other testing sites as well across the state of Kansas, so I'm wondering how that's going to impact the testing turnaround as well. So we'll see.
Sorry.
Are you seeing their numbers come in to you?
Yes, the positives do get reported directly to the health department. All testing is reported to KDHE, so we can log in and monitor from there as well. With that turnaround time, as soon as people receive results, they also get a copy on their phone. The one troublesome thing is that negatives and even positives will know their result, and we don't have that result yet. So sometimes there's another 2-day turnaround for us to then have that result to then call and follow up on. People do have the ability to send a PDF copy over to the health department so they can issue their return dates, quarantine dates, and that type of information, but we have to have that confirmation of results on file to then issue those dates. So those are some of the features that can be done. So you just have to convert it to a PDF and then email it to us, and then we can work on it from there.
I'm glad you said that. I didn't realize that, and having been tested myself with the 36-hour turnaround, as you mentioned, but they do advertise 48 to 96 online, so
Sure.
it can be longer. question, not to give you more work, but are you anticipating the vaccines arrival, and what capacity do we have to handle that? Or do you think it'll be commercial places like Walgreens, et cetera, doing it?
The most I know since so the state did release that they have identified storing locations and are working with local health departments and other area facilities to be registered as vaccine sites. We have registered. I actually just signed off on the final piece of that. So we're registered to receive vaccines. I still don't have any drop dates or information kind of along those lines, but that is something that we are planning for with our onboarding process, our COVID response team, our nurses, so that we're ready to act on it as soon as possible.
Yeah, and the reason I bring this up is I'm speaking to a group of doctors tonight about this very issue. I attended a webinar put on by KMS and Missouri Medical Society on Saturday, and I realize it's a moving target. But what I conclude from that is that we are unlikely to get the Pfizer vaccine that requires the super cool or ultra cool, as they call it, chain of storage. And I would discourage you from trying to go get a super cool refrigerator. I know we talked about that at one time, but there are issues in obtaining those. It's expensive. They're expensive to run. I do think, Pfizer goes to the FDA for their EUA on Wednesday of this week, but I suspect those are going to be like 1,000 dose lots. It's the only way they can transport that stuff, and that's not what you want to have in your health department. That I think we'd be overwhelmed by those numbers.
Sure.
The Moderna, and they go to the FDA on Monday, so a week from today. Is going to be routine handling, as you do for many vaccines. So I do think that I'm almost hoping we'll be delayed slightly, and we'll get the Moderna vaccine, which is just as effective. It's 2 shots as well. And again, it looks like there's going to be an app, and I don't think you'll get in the middle of the tracking, but the app will remind the recipient that they need their second shot. So the technology is going to be used, but again, call me if you get a delivery from the Pfizer folks, but I don't know how you're going to line up enough people in a session to get those. I think they'll go to large hospitals, KU, big urban areas, and places where there is possibility of that kind of storage already in place. They can keep it on cold with dry ice, but there's actually a U.S. shortage of dry ice.
Yep.
Because we're all getting, Omaha steaks delivered, and we're not making enough ethanol to make the byproduct, which is CO2. So there are amazing logistical issues, but I'm glad that you're thinking along those lines. I tried to get through the state's 48-page rollout plan. It's bewildering to me, even as a physician. So, I applaud you on controlling what part you can control. But I hope for your sake we get the Moderna vaccine.
So, I mean, if history is anything for us, currently we've had to react pretty quickly with anything that the state has released. So I'm expecting the same thing here. So we'll be ready to rock and roll as soon as we have that information. It's just waiting for that information to drop for us. But during that registration process for vaccine and being a site, we did have to submit all of our refrigeration and freezer capacity requirements. So the state is aware of what the components are at the local level. So that
Colleen, there's other counties that are doing surveys now, just kind of random surveys of people that are willing to take the vaccine, wondering if, just kind of get a handle on. Do you ever ask that question to the people that you test?
We have not asked that yet. There has been some information preliminary that people have kind of just said one way or another that they would or wouldn't. I think that those reviews are pretty mixed right now. I was looking at, of course, social media platforms, CDC and KDHE releasing information, preliminary, plans, and you have a pretty divided opinion on.
It would be interesting to see the numbers of people that are actually interested in doing it.
Sure. Yes, sir.
Again, if I might comment, the data out of these studies is exceptional. And these, despite this Operation Warp Speed and this unprecedented rollout, these are very robust studies. I mean, 30,000 people. And the kind of data they're seeing, I was looking for the numbers here, but there are 200 positive cases in each study in 30,000 people. 95% of the positives are in the placebo group, and 5% or less are in the actual mRNA vaccination group. The side effects are, if those of you who are my age who've had the Shingrix vaccine, the shingles vaccination, the side effect profile is very comparable to Shingrix. A light fever in 8 to 15%, muscle aches, sore arm for sure, headache. So they're pretty minimal. And there are even women in the study who became pregnant during the studies. They excluded pregnant women, and that's another piece we're going to have to deal with. I mean, we have pregnant and lactating healthcare workers, even though they're priority. So those women are being closely followed, but there's a natural experiment with even these vaccinations of pregnant women. As you know, it's age 12 and up, so we won't have kids yet because that 5 to 12 group is ongoing in their study. So I would encourage anyone listening to get the vaccine. I certainly will. If I hear of unusual side effects, I will certainly make that known. But I'm very encouraged by and again, it's a moving target. I feel for you and your situation. And again, I know we have artificial insemination groups around who probably have the cold storage, but I hope we don't have to deal with the Pfizer. But I wouldn't feel slighted if we're in the second rollout or we wait on Moderna.
Can you send me that study too, so that I can look at that data? Is that from like a specific published study that you are talking about?
I've been on every site imaginable,
okay.
Many actually investment sites where the companies have given release for other reasons. But that's interestingly, that's
sure.
the biggest source. And I can give you the link for the KMS Missouri Medical Society webinar. It was an hour well
okay.
spent.
Preliminarily as well, what I have seen released from some of the studies that have been sent out is some of those symptoms from vaccine have been very they've been extremely less severe than what others have been when contracting COVID-19. They have been minimal and have only lasted about 24 hours comparatively to weeks of sickness. So far, preliminary evidence has kind of shown that. So that's promising. I was kind of thinking of it about influenza vaccine, how that can also impact and make it less severe if you do become infected with flu as well. So.
No, I agree.
That's pretty interesting.
And even like with shingles, if you can get shingles, but it's less severe if you have the vaccination. And I agree. I also think there are going to be logistical issues, like typically in my office, we line everybody up for flu shots. Well, you're not going to be able to do that with this one. And you're not going to do it in your office. because you may have everybody out the next day with a fever. So there are some gotchas, out there that this vaccination rollout will have to be managed. But, I can't wait.
Be the next new challenge. So,
Yeah, and we're gonna mask up or at least use all the precautions still, even as we roll out the vaccination, because, the virus, is still there. Thank you.
Further questions for Carmen?
Mr. Chairman, mine are related to testing, kind of a three-part thing, but a couple of them are just logistical things. The go get tested, that's set up, is there an ending date for that?
They said through the end of the year, but depending on funding, I'm not sure how that will pan out.
Because I've been asked that question and I was just curious. And then I had a resident, visit with me the other day and said they went to the Genesis site over at the community college, and they were in their car, got tested, and they had their result within a few minutes. So I'm assuming that's under the heading of rapid test, in the terminology that I'm familiar with. So what would be the statistical number of the accuracy of that test versus what you guys and what go tested get tested site is using, where there's a 48-hour to 72-hour delay? Help me, and I know we've talked about this in generalities before, but help
Sure.
me and the people viewing understand the difference between those testing sites and positivity accuracy.
Sure. So generally PCR tests, so any tests that are the send out to the lab to process for accuracy, those are deemed to be 99.9% accurate. So any of those send out tests are specific to that. When you start looking at rapid tests, depending on the type of rapid test that's given, antigen, molecular, antigen or molecular, but then you have, say, Abbott, you have BD Veritor, you have Sophia 2, there's several on the market. Each of them have a very specific sensitivity and accuracy per test. So that's you just have to look at that per test, and that's given in their user manuals. So it's a wide range of accuracy off of that. At the health department, what we look at specifically is looking at onset of symptoms. So partly why our rapid tests and the way that the health department administers those is waiting for 48 hours from onset of symptoms, mainly because your viral load within your system begins to build. So if you allow the viral load to build, then test, that helps ensure a more accurate test. So it helps us work with the sensitivity of the test to understand what that sensitivity is. A lot of the negatives that we have been getting, we then diagnose off of symptoms and evaluate off of symptoms on, if you have people that are highly symptomatic, that still have fevers, that still have body aches and other things, then it's okay, you're still very sick, you still need to stay home. Just because it's not COVID or we didn't get a rapid COVID, we would suggest a follow-up with a PCR test to confirm that result, to ensure an accurate result there, and then refer back to the primary care physician if that PCR is still negative, and or after their rapid test still say, you still need to follow up with your primary care physician since you are highly symptomatic. You're still obviously sick even though it's not COVID. Again, it just really depends on the type of test. There's a wide range. It goes anywhere between 90 and 100%, but a lot of that is specific to how soon after symptoms onset that you test.
And then my follow-up to that, and then I have one other question to the testing that's been brought to my attention.
Sure.
You had scrolled to it earlier on this dashboard page, down at the bottom, the testing, the health department, Genesis, go get tested, or whatever you call that, go get tested. Should there be footnotes or asterisks that Genesis is doing this kind of test and you're doing this kind of test, and I'm just asking a question, I don't have a recommendation obviously, but so that people know the potential accuracy of the test that they're taking?
That is something that I'm willing to take back to our group and kind of vet before we decide on that.
No, and I'm not trying to
Sure.
put you on the spot this
No,
morning.
you're okay.
But it just raises that question in my mind where someone drives in, gets a test result in a few minutes versus somebody getting a test result in 48 hours or 72
Sure.
hours.
So the education on the accuracy and
Exactly.
sensitivity of those tests,
Right.
that just because it's negative doesn't necessarily mean that it's an accurate result,
Right.
versus just because it's positive doesn't mean it's an
Right,
accurate result.
so I would just raise the question, no recommendation. My last one, I've had several people send to me a lot of different studies, a lot of different, articles. And one that's caught my attention several times, but I don't believe I've ever raised it with you.
Sure.
Is one that talks about the cycles and the amplification and the cycles in the testing. And I'm gonna read just a couple of sentences real quick. Recent research shows that to maximize accuracy, PCR tests should use far fewer cycles than 40-45. At 17 cycles, 100% of the positive results were confirmed to be real positives. Above 17 cycles, accuracy drops dramatically. By the time you get to 33 cycles, the accuracy is a mere 20%, meaning 80% are false positives. And that's from a research study. So my question with that preface is, what is the cycles that we're using at the health department when we send them off to the KDHE lab or whatever we do?
So that's information that we don't have here at hand. That's sent over to KDHE. So then that would have to go to the K-Health lab to then ask that question, because they're the ones that do all of the testing. So that's all done in the laboratory of how many cycles in that threshold to test. So it's in the way that they analyze and break down the specimens.
Well, and the question that I'm being asked by several people is, what are the cycles? How accurate are these tests? And it appears that the cycles the number of cycles is a huge factor in the accuracy of that positivity rate. So
Sure.
Again, I just raised that.
Yeah.
As
On the
a
rapid test that we do in-house, we don't have that information, so it's on all of those PCRs that are sent out to
Yeah, and they're
K-Health.
talking about PCRs here in this research
Yes.
study.
Mhm.
And then lastly, and I pose this to the rest of the commission, the CDC just last week, I think it was, came out with new rules, I guess, if you will, or guidelines for the quarantine period, from 7 to 10 days rather than 10 to 14 days and so forth. I'm shortcutting this thing. And what I noticed across the state already, Reno County and Ellis County have adopted the new guidelines as a county commission to the new CDC guidelines. So this is a question to our group here. Is that something that, not today, I'm not asking for something today, but is that something that we need to discuss, and whether we need to take action to either to adopt that, or we stay with the current and so forth and so on, and Bill probably knows this better than I, but I found it interesting where Reno and Ellis County particularly, maybe others, or not particularly, specifically, have already taken action on the new guidelines.
So if I may say something real for just a moment.
Oh, sure.
State statute, that decision is up to the local health officer, not the Board of Health, because we are the ones that put in the quarantine orders. I have that information in my email from KDHE on where that decision lies, because we're the ones that have to enforce the quarantine orders. I will speak to it too. We received a copy of that about 20 minutes before it was released. That does not give the health department adequate time to respond or also prepare logistically of how we're going to handle that, because one of those things is we're going to have an increase in testing at the health department and also at the drive-through site, because it's all PCR tests that have to be completed on either day 5 or day 7. And then for a release possibly on day 10, depending on that result. So part of that is gonna be the logistics of it, so if people decide to go to the Go Get Tested site, we would have to have those results of a negative result immediately before we could release the close contacts to a positive on that day, 7 or 10 or 12, whenever we receive that result. So there's some logistics that need to be worked out there, as well as then proper tracking of last day of contact with a positive on day 5 or 7. So what our plans were is to continue to go back, look at our logistics and our operations, figure out how we can do better tracking of that, how we can meet the demand of increased PCR tests, as well as processing our investigations quick enough that we can immediately follow up on those as soon as those come in. So there's a little bit of work that we have to do before we can handle that, and then we would do a news release on either adopting or not adopting those new requirements.
And I'm not disagreeing with what you just said, but I find it interesting because unless I misread the articles, the commissions in those two counties took the action. So I find that interesting
Sure.
information, and I did not know that.
Yeah, I know it's been a big question because when it was released, there was no authority released with it. So KDHE and kind of our listservs, because we're on the listserv with all the public health officers, have had a lot of discussions about that. And then Dennis Kriesel, so he released that authority. So I'm happy to send that and share that. I know a lot of counties just reacted quickly to that last week to kind of make that decision. I want to be able to do it well here and have the correct tracking and the correct follow-up, and so that's why I'm asking for more time before we really say, yes, this is what we're going to do.
Okay.
We've had a couple of employers that have called us who have tried to do the same thing. Employers and businesses can be more restrictive but not less restrictive from the health department, so we still need to be releasing people that are on quarantine to those employers. So we've had a couple of those questions and had to call to kind of just know.
I very much appreciate the clarification, and yes,
Absolutely.
I know Dennis real well, and,
Sure.
and good friend. But yeah, I don't know if these counties acted prematurely or what, but I saw that over the weekend in those two counties.
Sure.
Thank you for
Yep.
that, and Mr. Chairman, thank you for your vote.
Further questions for Colleen? Thank you very much.
Thank you.
Appreciate all the work you and your staff do. Let's take a 10-minute break and we'll resume no later than, not even 10 minutes, we'll resume at 10:30. Okay, solid waste management plan annual review. Roger, your turn.
How are you, gentlemen?
I think we're on.
Good.
Actually, the annual review, nothing has changed except the membership. That's why you received a copy of the membership that have changed. The committee was asked to submit any ideas for changes to the solid waste plan, and none were received by the office. Every 5 years we go through a more in-depth review of it. Basically, we would just need you to review the existing plan as it is with the changes to the membership.
Do you have a copy of the existing plan?
It's 94 pages long.
Chairman, if we need action, I would move to approve the solid waste management plan.
And I'll second.
Go ahead.
Been moved in second, discussion. Roger, you put up a list of your committee members. Is anybody, happy, everybody's happy to remain on that committee, or other than the vacant one from the city?
Everybody, I guess, I have to talk to Larry.
Is this kind of a life appointment?
Yeah, it seems like it.
And you don't get to do anything, but to be with the company, so.
As long as you don't make me read the whole plan.
Yes, it's 94 pages, that's why I didn't.
I don't want to see that either.
And that's why you just do it every 5 years too. So.
Quick question though, while you're on waste management, we got a bill from, the landfill folks for well monitoring going back to 2015 for $80-some thousand. Why don't they bill us annually for that?
I can check, I don't know, honestly.
That seems like a little.
Yeah, in fact, I think that well is gonna be coming out of that monitoring program here in the near future too.
Well, they're catching up.
Yeah, I thought that's what John had told us.
Yeah, I think that's right, that well, and I'll double check that for you.
Okay.
I think that well should be coming out of that program before long.
Further discussion on the motion?
April bill.
Well, then maybe this is the final bill for that, I don't know.
They just happened to find 5 years of testing.
All in favor of approving the waste management plan, signify by saying aye.
Aye.
Motion's carried.
High Risk Rural Road pavement project, back in, I believe it was November, KDOT let bids on the striping program through the High Risk Rural Roads initiative. As you can see, Road Safe got the low bid. You received a copy of all 3 bids. Road Safe got the low bid, and the way this works is the local road safety projects that we do, you have to do that process, go through that process to be eligible for these funds. These funds are coming from KDOT, but the KDOT action is actually just a conduit through the federal government. So this is going to cost us nothing. It's a 100% to zero match, is what they call it. They're going to stripe, it'll be about 194 miles of roadway in Finney County if approved. That'll be center line and fog line will be done. There's really no reason to not accept this bid, that I can think of. Any questions on how that works, or? You have to participate in high risk rural road projects to be eligible for this funding.
Mr. Chairman, I move we approve the high risk rural roads project.
And I would second that, but I do have a question.
It's been moved and seconded, discussion?
One time, we visited with, when John was up here, and this has been months ago, about Towns Road, and double striping, no passing, and so forth on that road. Is this would that be a part of this project? Because it's a terrible issue still out there.
Yeah, actually, I'm glad you brought that up. It'll be all the blacktops in our county, 194 miles or whatever technically. But also what was addressed through this was the passing zones. So all the passing zones are going to be reset. That'll be the only one thing you might notice as a driver too. The distances will be different for the passing zones. So they've already done that study, so they'll stripe it accordingly. but he's passing.
Well, I'd love to see it all no passing, even though that doesn't keep them from doing that. It, you know, at least gives law enforcement some, heat. Yeah, thank you for that.
Further discussion? All those in favor of approving the high-risk rural road motion, please signify by saying aye.
Aye.
Aye. Motion carried. Okay, the road vacating.
Yeah, we're vacating Friend Road, or Road and Grounds, do you have this? Or do you need this? That's what
They already have it, yeah. Yeah, so this is something that John and I worked on with Robert. So I believe it was November 2nd that you accepted the petition for this road, which was included in your packet. At this point, there are a few actions that need to be taken. You need to appoint viewers to go out and view this property, set a viewing date, which needs to be between December 21st and January 1st. And then we'll need to set a hearing date, which I recommend that to be the next regular session, or the first regular session in January, which will be January 4th. That should say 2021.
Well, assume, Roger, you sat down with us, you're gonna be part of that as well.
Well, the last time we vacated the road, it was myself, Dr. Clifford, Randy, and Anita, or not Anita, who was before? Elsa, I think when we, did the road, if I remember correctly.
And the statute's only required three.
Yeah.
Required 3A. Is this in?
Dave's.
I believe it's Dave's district.
Dave's already said he's willing to do that.
Do we need an alternative for Dave, just in case it doesn't work out for him?
Probably should. Of course, you'd have Roger that would go, obviously, on that, as I would imagine.
And it'll be a couple of weeks before that actual viewing, so we would have time to.
Okay, so then there's an alternate that needs pointed today.
I would go ahead and name one today.
So I'm quite familiar with the facility.
I would go ahead and name one today.
Thank you.
I'd be an alternate today, if he's able to, take care of his district.
Okay, so that's Dave, Roger. And who else?
Roger.
I'm not going. I mean, it sounds fun and all. So Dave, Roger, and then Dwayne would be an alternate for Dave.
Pierceville door, what's the deal?
Pierceville.
Or Plymouth?
Well,
Well, see, I don't even know where you're doing.
Other
this
side
at.
of the county, Larry.
In all seriousness, I think it would be appropriate for our administrator to be there. No, I mean, I'm serious about that.
I'm sure I can.
You need to know where friend is yet, Minister.
It's just straight up 83.
Yeah.
Well, you're good. Pretty good.
All right, so Robert,
Get to the county line.
All 9 households.
do you need a motion? We need motions to appoint them, I
Yes,
see,
you would.
please.
I would, so move the names as you've written them down.
Second.
Thank you for the second. All in favor of the motion for the appointments to the road vacating with friend, signify by saying aye.
Aye.
Opposed? Motion carried. Now you can sit down. Thank you, Roger, very much. Appreciate it.
So the next thing we'll need to do is set a viewing date and time. We'll need to do that just based on publishing and how long it has to be published before the viewing. And the lead time we'll need for publishing, we need to do that sometime between December 21st and January 1st.
I'll be here, it doesn't matter, I think Dave will be here, so either you guys gonna be on holiday travel?
Which date again?
We just need to do it sometime between the 21st and the 1st. So December 21st and the 1st.
What's everybody doing the 25th?
You guys take a leave or something?
Not hanging out with you.
Bob,
For me, sooner would be better, I would imagine, because as we get closer and closer to the end of the year, it gets pretty crampy.
I believe the 21st is a meeting day, so you could schedule it for following the meeting that day or
Yeah, the
something.
afternoon, the 21st possibly.
About 1 o'clock, the 21st. I'm just throwing out a number.
I think that would be fine.
As long as you can have our meeting, no, I was kidding.
That'd still be up to you.
Just kidding.
All right, so is that that?
You on the clock, buddy.
So I guess I'll need a motion to set that viewing date and time.
And include that in the motion, would you? Is that
Who's
fair?
making this motion?
I'll make it.
All right. New motion.
Just did it. Viewing 21st at 1 o'clock,
1 p.m.?
1 p.m.
Second.
All those in favor, say aye.
Aye.
Motion carried.
All right, next is to set a hearing date and time, which our regular session after that viewing would take place on January 4th.
Move to have the hearing date set as January 4th, 2021.
Yeah, I messed up on that. Do we wanna do that at the top of the meeting at 8:30? I assume,
Yeah.
since it's public.
We could start, you make it 20 till or something like that. Agendas and minutes.
So at 8:40?
At 8:40.
8:40.
So moved.
Second.
All over, those in favor of time, 8:40, signify by saying aye.
Aye.
Motion carried.
And we also need a motion to authorize publication.
Correct.
So we'll need a motion to authorize publication in the newspaper and, to send out a certified mailing to affected property owners.
So moved.
Second.
All those in favor, signify by saying aye.
Aye.
That's a lot of motions for one road issue.
Right, that's what this is my first one.
That's why we don't wanna do them too long.
All right, with that, I'll get all this background stuff taken
Start the
care of.
process
Yep, thank you.
and continue on with your Sherlock Township trustee appointment, Doris.
Yeah, so I did send you guys, and I provided a copy this morning of, the results, just in case you wanted to look at those. But Matt Jones did decline the Sherlock trustee, township trustee, because he's already treasurer and he'd like to keep that position. So since he was also elected for township trustee, we'll have to have you appoint somebody. So I've provided you with the report that lists out the write-ins, other write-ins that were written in on that race. You are welcome to appoint somebody today if you like, or we can table this to the next meeting. And if we tabled it to the next meeting, we still have time to get them, get their oath and other paperwork done before they need to take office. So up to you today. If you have somebody in mind that would like to appoint, we can go that way, or we can table it until the next meeting, allow you some time for recruitment.
I would suggest you just go down the list, Dory.
Well, there's a tie in that second spot, so.
Do what?
There's a tie in the second spot, so do you,
Well, I suggest we contact the top three and see if anyone volunteers or
Yeah.
would volunteer. Greg, Matt, and Janelle.
Janelle is the mayor of Holcomb, so if she wanna take
Yeah.
on another job or,
I don't know if there's a conflict in that,
I don't
offices or
either.
not, I don't think there would be, but.
you might just do the top four, that way, if there is a conflict.
There's a no top four, then you got, four more.
Yeah.
But
So I guess-
couple of those you can rule out, I think. I think you just, based on your list here, just go to Greg first, Matt second, then Janelle. I'd still keep Janelle in there.
So are you guys, are you going to appoint?
No,
Greg, or?
just see if they're willing, see if they're.
Okay, so you want me to see who's willing, and
Yeah.
then you'll make a
And
decision
I would
based
just
on
kinda work
those
down
who are
that
willing.
list, work down that list on the next three.
Go down the list till you find a volunteer.
It doesn't do us much good to appoint them, they don't.
They won't do it.
Won't do it.
The only one that I would question, not because he's not capable, is tactician, because he's gone so much, out of the year. And that's the only one I would question, those top 10 or so, you know, as far as availability and things, but that would be my suggestion, just kind of see what the interest is.
See if you can find a volunteer.
Well, I'll bring you some names then to the next meeting, and then you can make them right numbers.
Good.
Have fun.
I was trying to give this to you all.
Bring him out.
See how well that worked for you?
Yeah, it's not to be sneakier next time.
Anything on board government's done? Administrators report.
Okay, real quickly, I know that a couple of you sat in on Thursday, Thursday's meeting up in Spark Grant. We did have a report for the fiber project that was due on Saturday, so we did get that in. We do have a report this week for the Spark Grant, due on Thursday. And so we'll be working to get that in. I also have trying to get information from the Department of Commerce. They did have some resources available on that connectivity grant. Remaining, they were supposed to assess how much. We put in an application for additional funding for that fiber project on that. It could be up to another $480,000, depending on what's available there at the Department of Commerce. So we're hoping to hear from them over the weekend, but that did not happen. So hopefully this week we'll know. Doug's provided you a good overview of what that project's been looking like. We're going to have county offices and staff on here in processes. So that will continue on. As you know, this week we're pretty busy here towards the end of the month. If I remember correctly, I believe next week we have some auditors in-house on preliminary stuff. Is that
They'll be in here Wednesday, actually.
actually this was? Okay. So they'll be doing some preliminary gathering of information, and then just a host of other stuff that we tend to fill it in. Do you have any specific questions or comments or concerns?
Questions for Robert? You got you off easy.
Very good.
Thank you.
I have nothing to report.
I think I might mention Southland Road issues, talked to Roger about it. I've been asked to become the treasurer for the KLPG. If none of you would object to that, so that I'll work through the vice president and pension president of KLPG. Claire's done that before. You? Done it? No. Lon's mainly a KAC representative, so I'll step up and work with KLPG. You heard about the Spark and Idea Tech meetings. I'd like to remind everyone today's Pearl Harbor Day, 79th anniversary of the attack on Pearl Harbor. It's commemorated on December 7th when it occurred in 1941. And that's all I have.
I did attend the Spark as well, Great Plains Development monthly meeting. We had 3 resignations off the board, so we're down to 7, I think, maybe 8. And so we're scrounging around for more volunteers. Hopefully county commissioners would step forward in the surrounding counties. Other than that, that's it. I will be out of town for Thursday's Spark meeting, so when gentlemen would like to join Dr. Clifford for Spark, you're welcome.
Yeah, it's 10 o'clock, right?
Correct.
Yeah, I'm questionable, but if it works out, I'll try to be
Busy week. Other than that, that's and I've already talked to Dory. I will be out of town, so hopefully we'll have some signature pages in. I can get that done before I leave Wednesday for the grants. Okay, one.
Just a couple of things, and then my questions are more about the next item, about commission meetings, but I don't know if each of you saw that my former House Representative Maxine Law died last week, Wednesday, and 87 years old, and they had taken him to Dodge City, and he died in the hospital over there. And then with regard to KAC, I do plan to stay in contact with KAC, but my term on the board ended a week ago, Friday, and I have to sit out before I will be reappointed if I ever reappointed, but I'm turned down on the board. So, but I will continue to monitor KAC activities and so forth. And that's about it.
All right. The next commission meeting, Dr. indicated she will not be here, correct?
Yes, unfortunately, long-term commitment on Monday the 21st, and I feel not bad about that, because I'd like to be here for a discussion of the sparks on disposition. I was wondering if you have a need to meet next week to keep moving money out the door, or if Robert would
We've granted Robert that authority to, the only ones remaining would be the household grants. And other than that is the City on the Hill grant that you'll need to come to some type of conclusion on. As far as I know, that's it.
So my question, Robert, do you see a need to meet between Christmas and the New Year for a final disposition of the spark monies if we don't get a deadline extension?
I would only anticipate that if we cannot pull everything together by the 21st, we may need to have a final wrap out. But we probably won't know that until we probably close to the end of next week.
Well, my question with regard to future meetings is January 18th. I won't be here, but that's also, I think, Martin Luther King Day, and I didn't know if the meeting was going to be on that Monday or if it was going to be that following Tuesday, if it was going to be on the 19th.
Preliminarily, I scheduled it for the 19th,
Okay.
so I've got on the 4th, and I think I'd like to do the swear-ins on the 4th. Swear everybody into their respective offices that day.
And then the second one in January will be the 19th?
Yes, that's how I currently have it scheduled.
Okay, because I could be here for that, we're coming back on the 18th. And then, Mr. Chairman, you had referenced to the mayor, a work session in January or something. Is a date been set for that? Or
We have not set a date. That was our consensus, I thought, a meeting or two back to have a January work session.
right, but I didn't know.
Should go ahead.
Can we do it that afternoon of the 19th?
We can shoot for that. We'll go ahead and set some time and see if they're.
I think I'm open all day.
That'll be, our new chairman's problem to organize that, which is just fine.
Yeah, I can be available that afternoon as well.
And that's just a county commission work session, correct?
Correct.
Okay.
Okay, so we're.
Not a joint.
So we're scheduled for the 4th, right, Dory?
The 4th? Yep.
And the 19th. Okay, that was my questions.
All in agreement? Okay.
Excuse me, just one clarification on this work session. Is that going to be like at 1 p.m. after lunch? Or
Yes.
will you have it directly after the morning session?
But see, that's normally their meeting day, and they normally meet at 1 o'clock, do they not?
Well, I thought this was just for us.
This is just the
Oh,
county.
just for, okay.
Just for
Okay.
county commission,
Okay.
but yes, the city will be meeting.
They would be
on that
meeting.
day.
And, by next meeting, if there's topics other than fireworks that we need to get on this, let's
Sales
get back to our
tax.
ideas for topics.
I know sales tax was something. that was
Sales tax.
supposed to be-
roads,
Roads.
road projects.
Those are probably the sales tax and roads are the big issues.
To her question, do you want to set it at 1 o'clock that day? Or how do you want to do that?
We can have sandwiches or something brought in after the meeting.
Well, it's kinda hard to say how big that meeting's gonna be already for this
Right.
far out, so.
Right, that's what I'm wondering.
Let's assume it's the normal 11 o'clock time, so it's kinda tough to, unless you wanna start one 11:30 and then 17th and then you on.
Yeah, we can just, I think that we can say to follow the regular session, and just continue it and then have lunch brought in,
It's just,
assuming we'll go through the noon
I
hour.
think that's,
Works for me.
works. Okay,
Sounds good.
And we need to just make sure that Dave gets that information about the 4th and 19th and stuff. We just need to make sure he gets that. Not, I don't think it'll be an issue for him, but
Just, you'll need to have Roger here for that work session too, so.
Yes,
and appropriate staff.
if you don't mind, I wouldn't mind including all the, your department heads, if that's okay.
I think that's fantastic. Anything further? Adjourn.